these instruments are really helpful to the patients of sleep apnea and as well as the music learners also, because they also have to increase their breathing capabilities for long laughs and everything, So I think it will work wonders for music learners. Thank you so much. The next topic is learning music itself works as a therapy. So this will be presented by myself. So my introduction already sir has given. So I'll start with the topic. So learning music itself is an effective mode of therapy. The paper is written by myself and my Guruji, Sanjeev Chauhanji. The introduction, you already know that the concept of music therapy, although in infancy, is gaining a lot of attention these days. All of us are here for this purpose only. The amazing effects of music and the actions we have already discussed on the body and mind. There are various factors which are responsible for the effectiveness of any therapy rather, and especially music therapy, because the music used for the therapy, it has to be selected with the feelings and the requirements of the patient in particular, and not by its excellence or by liking just by common masses. So this is the main aspect, and I'm presenting myself as a subject here, not as a music specialist and a teacher of music. So like any doctor, when he gives a medicine, he wants his patient to respond like that, how it is working. So I'm just here to present myself, like to show the effects of these music doses, right? So the present paper, so the emphasis is on learning music and its effective therapeutic application. And it has been observed by our group that learning music itself, instead of just listening, it's and learning from an expert musicologist available maybe as a teacher or as a guru or as a music therapist, it proves to be more effective. And it is, now what is the main thing that needs to be taken care of? It is the bonding between the teacher and the subject. That is very logical, and I think we all know that when we go to a doctor, and sometimes when we go next time to a hospital, we want the same doctor should be there who already understands me. So that bonding is very important. So that bonding between the teacher and the subject, and the bonding that the teacher creates, what? Creates of the music components with the subject. So like Sairam sir has introduced us to the music, the concept of music therapy. He has involved us. We were all involved, right? So that involvement is very important. Involvement with the components of the music which is going to affect us. So that is very important. And that has to be taken care of by the music therapist before he starts his therapy sessions. And it is it can be done by giving details of sur, tal and lay. Like maybe we don't know much about the music, even if we don't know. But when he gives us the different significance of these things, he explains the significance and the connection with the basic roots of swars, and giving answers to, satisfactory answers to every how, why, what in the music also. So that, that creates sort of strong bond. We say covalent bonds and like electrical bonds and the electrostatic bonds in chemistry. So it's something like that. It works like a covalent bond which is very strong. And then discusses the effects of each swar, and that is very important. So these effects, it has been observed that by discussing the effect of swar, its effects start working. Let us take example of the morning session when we were hearing that 8,000 hertz music, and it was like we were feeling a different way of its effects, right? You all have observed it here only. And when Sairam sir told us, like concentrate here and then now listen, so it had a different effect. So the same thing affects you differently when you are connected with that component, and when your guru or the therapist, he makes you get involved in that particular process. So that is again one of the basic concept of my lecture here, that your involvement is very important, and the student or the subject or the patient, they start feeling the same effect of note that Guru experienced or that the therapist experienced and explained it to him. That you have done practically today. So the effects, for example, of Bhakti Ras and Karun Ras, it is created by two notes, that is Komal Rishabh and Komal Dhavat. And these two swars bring peace and calmness to our mind and soul, that we know from the literature also. So the Rag Bhairav like soothes our soul and the body gets relaxed. So there are different methods of music therapy being followed, and one of the group believes that the subject who is undergoing therapy, they should have knowledge in the discipline of music. What I was going through the literature and the things like that. And the other group makes the subject who is undergoing therapy to listen to the music and either actively or passively for his treatment, right? But presently most therapists are making use of the second method of therapy, that is making them listen to music and even rags, and even if he or she doesn't have knowledge in the field of music. So I would like to mention here that there are various factors which are affecting music therapy. Let's first look at the second line of thought, the second point. That is, there are actually so many variables which can affect directly or indirectly the line of treatment while employing this as therapy, music as therapy. And we have to take care some of the following parameters when we start the therapy. That is your personal preferences, your age, your gender, whether you are female or male, and the area to which he or she belongs, whether to south or to north or west or something like that. Your educational background, whether I am basically from the music background or from some other field, science or arts, or then family background, whether you are promoted by your family to take to join music courses or not, right? And then your interests, personal interests, and your hobbies and so on. So in addition to this, taking care of all the above parameters, one must consider the subject's personal preferences in the music instruments, like you would like to hear guitar or sitar or veena also. And how does this therapy affects? The effect of therapy now depends on the angle of listening of the subject and his concentration level. Whether you are really concentrated or you are just sleeping and just attending the lecture, right? So the question is how to centralize his attention of hearing. How will we invite his indulgence? So I think that way Saidam sir is the best therapist for all of us, right? So if we are playing a rag, and for example on veena, and one loves to hear it on guitar or something which rocks him, right? So he may not be able to build up connection with that rag. So the sound of that particular instrument also may not attract him because he's not interested in that particular instrument. So just only listening music may not be successfully working. It is more important that the subject is fully involved and indulged to get the maximum positive benefits out of the therapy given. So if it now take into account the first line of concept, that is you should have knowledge in the subject of music. Now just saying that also, that one should have knowledge of music, is not enough, right? It may not be, it may not create or develop indulgence in the form of therapy because they have not experienced the real taste of music. They have a knowledge, they have degrees, but the degrees don't work here. What works is your feeling, right? And so they have not experienced the real taste of music and its soothing effect. They have not experienced sur, tal and lay, the amazing effects of ragas, which gives tremendous feelings of, as we all know, emotions like happiness, compassion, empathy, spirituality, encouragement, motivation, empowerment and confidence, right? So according to my view, I strongly recommend that learning music and feeling and experiencing music, that journey, it is the best way to dilute the ill effects of any disease. Now ask me how. So it largely depends on how the therapist perceives, right? It's the perception. How does he understand and analyze you? So that is very important. So all the therapists who are working, so they should have that type of individual concerns also with the subjects, right? One thing is that common lectures we are giving to all. One thing is that involvement in the individual patient and diagnosing the disease of that particular patient and then treating them successfully. So so how does he understand and analyze his personality, his problems, his behavior, his body language? his age, gender, interest and education, all these factors, and then designs the steps of his treatment. So he needs to design the therapy, making use of his music skill and knowledge about ragas and their specific effects, like the choice of notes. That is very important. Which note is affecting a particular person? Choice of notes, the particular words of the bandish and that affects the subject the most. And that should be in the exact conformation. It's again a biochemical term, that it should be in conformation with the emotional components of the mind as well as the chemistry of the body of the subject and also his circumstances, whether it actually is going to affect, so that the therapist has to analyze, right? So the journey of learning music is very beautiful, as I said in the morning. It is understood that although learning music in its true form is not that easy, but the journey of learning music and the path of music learning, enlightened by the right therapist or the guru with the real concept and the significance of having been understood, so that leads the subject in the direction unforeseen and the patients get relief from ill effects of various diseases. So music today is being present is employed more as an adjunctive therapy, but to become an independent discipline of therapy in the right approach, so you need, of course, a lot of experimental and scientific support. That is the need of the hour, that we now go into this direction seriously, right? So a collaborative research-oriented orientation is necessary between the medical professionals and the musicologists, and that needs to be promoted, and that research has to be conducted. So making use of the interdisciplinary approach and to merge the two fields and tackle different variables in science and the music, right? And these two disciplines, they are going to make the music therapy even more effective in the coming time, right? So now what do we do in our group? So very brief summary I am going to give you. We take care of the age and interest of the subject. We choose an instrument to be played by the subject. That is the first step we take. Then during the initial basic lessons, the subject somehow starts feeling much involved in the music, because somewhere the lesson draws his entire concentration. So that is what has been happening to me. So the first we train his mind and generate interest in the music. And according to our line of therapy, our group, that slowly and gradually he starts paying more attention in the each and every happening, that is everything that is happening in the music. They start drawing attention, towards tal, so they start tapping, they start playing tabla or something like, they start feeling that something is there which is in rhythm. So that even the sur, they start following, and then they start making use of that happening, So that trained mind now helps the body to get trained in singing as well as playing the instrument. And here, now we think the patient is now ready to respond according to the rag. So now it is trained and he responds to the therapy, to the rag therapy. And now at this stage they can get involved in the rag easily. He should learn to listen, and now when he listens or plays, he responds positively to the therapy. And with untrained mind, there may not be response as we are expecting, right? So response depends on his presence of mind for that particular rag. Otherwise, even if the rag that is known in literature to have therapeutic effect, that will not show its effect. It will be like you are banging your head in the wall. It was there for me for 1.5 years. He could not make me, But it's not because of he did not have the potential, because I was not receiving in the form I should. Because so it's the problem with the subjects, the females particularly in the North India who are already expressive, going on with so many disturbances in the mind, for home, for job, for this, the children. So you're not at the receiving end. So you have to be involved, and that you start getting the effects. So music therapy, as I'm introducing here the term primary and secondary effects. So this is what I'm going to explain as a new concept. So because there are primary metabolisms, secondary metabolisms, primary therapy, secondary therapy, primary effects, secondary effects, and we have primary and secondary effects of music therapy also. So what are the primary effects? It helps in the treatment of various diseases, as we have reported in literature, and if we are going through the literature and to the search books. We have all the things available as text. As secondary therapy, it works to treat diseases like allergies, breathing disorders, voice disorders, menopausal symptoms, and improves the immune systems and many other things. So you will feel it what is that secondary therapy, right? So there are additional benefits like to improve your patience level, self-confidence, feeling of being empowered, especially women empowerment when is the age of women empowerment. So again, the females who are going under depression and who are suppressive, they cannot express their feelings. Now, once they enter into music, I have really seen transforming them. The women who never used to speak out a single word, now they are, they have changed lifestyles. They have changed their mind, they have changed their diseases and status, and the concentration in all activities. There are social diseases also. You will say, what are these social diseases? So these social diseases in Indian society, especially women and children, they are affected by so many social issues as I have just discussed. They either submit themselves to the social constraints and get either mentally or sometimes physically sick. And they are such submissive and suffering section of the Indian society. Music therapy really works wonders and it shows marvelous effects in the treatment of such cases. So if I treat myself as a subject, and as I've been informed that I'm PhD in biochemistry and I'm a professor on the same subject. I'm also the subject of this study I'm presenting here, and I won't hesitate to say that I was also a diseased person mentally and physically. Maybe for a normal person I was okay, but for myself I speak about myself that I was really. And if we talk about my mental status, the primary effects which has helped me, that I used to cry all the times with the memories of my mother who expired in the year 2000, and I was not able to bear other stresses at home and office, right? Maybe I was suppressive not to express my feelings, but I was actually under such expression. And I started learning music, although it was very late in 2011, it was 2000 and 2011. I could release my emotions by composing the song in her memory and in my mother's memory. The music was designed by the music therapist, my Guruji, and he's co-author of this paper also. He could manage to design the therapy in a way that works so well for my state of mind. And the Komal Gandhar in the composition, it was so effective as a sur that made the therapy successful under the defined conditions. So the effects of sur, I am now here giving stress on the effect of sur. So he composed it in Vrindavani Saral, but he gave the effect of Komal Gandhar in between. I would like to show you here, to make you hear this. I think it's working, or? Can we? This one?
It's a lovely route. In Karnataka also.
Yeah.
You know Komal Gandhar in Karnataka? Vrindavani Saral?
Yeah. It's sub-compositions like Dikshita in
Yes,
South
sometimes they use
Karnataka
other
has not used. Some